go over the cranial nerves first. The olfactory nerve here and here. And it's kind of a flat, weird looking little thing, but it comes up around the frontal lobe. So there's the olfactory bulb. The optic nerve, again, is cut, but you see here and here. All right, they're kind of round on cross section, kind of long. The optic chiasma is where they cross on the midline, and you can see it's cut on these guys. But on this one here, the optic chiasma is intact. All right, so here's your optic nerve, chiasma is on the midline, your olfactory bulbs. Now, this one's got the pituitary intact. It's still right here. It is cut in half, but you can reflect back the pituitary, and underneath you can find the oculomotor nerve, and that is that one right there. Gotta kind of pry it out a little bit. You got to be careful because the dura does come off the surface of the brain, and some of these nerves they'll pull off with the dura. All right, so now the other nerve of interest is the trigeminal nerve. That's this big, large one. You can see there's three large branches. Right? The first two are rather visible. The third is kind of smaller, but that's going to be on either side of the pituitary. You can see this guy. There goes 1, 2, and 3. And on this brain over here, the trigeminal, it's intact on one half, but you've got 1, 2, and 3 branches. You can kind of look, you can see where it attaches to the brain stem, right there. I've got everything else kind of removed. Now in this brain, you see the oculomotor nerves, because I've got the pituitary would be sitting right here. The pituitary is gone. I've got it removed. You see oculomotor, and you also see the two tiny abducens nerves here and here. Now the abducens kind of where they attach kind of forms the boundary between the pons and the medulla. So you've got the pons anterior, abducens, and medulla posterior. And this one over here, when you still have the dura intact, the abducens can be found by flipping it back and being real careful because it pulls off with that dura. But there's the abducens nerve. And it's actually been cut on the other side. Very, very delicate. And again, trigeminal. Now if you look at the mid-sagittal section, you have the pituitary. Just anterior to that is the optic chiasma. If you're not sure, just flip it over and you see the nerve. It's the optic chiasma, pituitary, corpus callosum. So this nice large structure here. Again, the communication between the left and right halves. Now the third ventricle you see is this space that opens up just above the thalamus. The thalamus is this round portion right here. Pituitary here. Now as far as hypothalamus, I always just kind of draw a line from one to the other. Remember the pituitary attaches to the hypothalamus, so I just find the thalamus. That's easy because you see it's just under the corpus callosum, pituitary underneath, so hypothalamus, I call this area here. All right, now as far as ventricles, the lateral ventricle you can get a glimpse in right here, okay, this opening here. You see the choroid plexus in there a little bit below. Being too still. You see the choroid plexus in there. It's again where the blood filtrate that creates the cerebrospinal fluid. All right, so lateral ventricles are 1 and 2. Ventricle 3.
Which one is the one?
Ventricle 3 is this here. Basically, it's under this bottom lip of the corpus callosum and above the thalamus. So okay. Ventricle 3 surrounds the thalamus. You see the corpora quadrigemina here, just posterior to the thalamus, basically between the thalamus and the cerebellum. So cerebellum and the arbor vitae, if you notice this kind of branching tree-shaped structure, the white matter of the cerebellum, that's what they refer to as the arbor vitae. Now the fourth ventricle is basically this opening here underneath the cerebellum, between the cerebellum and the medulla. And the cerebral aqueduct, if you look, basically this continuation of open space between third ventricle over the corpora quadrigemina into the fourth ventricle. That's what's referred to as the cerebral aqueduct. You can see that on this half as well. You just kind of have to bend the brain back and see the open space there. All right, now I think that's everything as far as your label.
Oh, when you, it's probably a basic question. When you're saying gray matter and white matter, how do you see, how it's obvious in the brain, to look at?
I don't think it's really that obvious in the brain. But if you look like gray matter, the cerebellum is mostly gray matter. I see it in the cerebrum. The white matter is the branching, the gray is everything else. That's kind of evident there. But really, I guess the cerebrum will be gray, starting corpus callosum in the brain, in the midbrain and the brain stem, diencephalon. I think that's really starting in the white, because that's really, you think about it, that's the crossing overs of the the neural pathways. As far as gyrus and sulcus, you can see it real well here as this brain starts to age. The sulcus is the groove in the gray matter. The gyrus is the surface. You see that here quite well too. In the sulcus, you've got vessels here throughout this. Right, so you got the dura intact there. All right, now on this one also, here's where you get a good view of the corpora quadrigemina. You bend back the cerebellum and brainstem. Corpora quadrigemina. These guys here, you got the two superior colliculi and two smaller inferior. Don't worry about them individually, just know the whole is corpora quadrigemina. And if I spread the cerebral hemispheres a little bit, just on the midline, just above that, you can see the little nubbin of the pineal gland. And that's how you see it intact. Usually it gets kind of hacked up there pretty easily. All right, so that's the pineal in there. And I'll probably have this one like this, just cut off like that. Yeah, and identify that as the corpora quadrigemina.